Hi, my name is Kathy McJanet. I'm one of a group of 4 that will be presenting Surviving a Pandemic, Strategies for Success in Academia. We're 4 nurses from different parts of the country. We hope you enjoy our presentation and join us for the chat at the end of the session. Thank you. Part of the experience that I've had with my nursing career has helped prepare me for this. I've been director of nursing for community college for more than 20 years. I've been in the military. I've been an ER nurse my whole entire life. As a matter of fact, I still work in the emergency department and continue to do so during my years as a director of nursing. I've served with ACEN as a peer evaluator for many years and also on the Board of Commissioners for 8 years, and I was lucky to be involved with such a group of women that supported nursing and nursing education. This clinic evolved in January of 2021. As an ER nurse, it was very challenging this past year to be involved with such sick patients, and we wanted to do something besides being able to care for them. We wanted to prevent the disease. So I chatted with Dr. Stone, our CEO of the hospital, about how we could facilitate a clinic in Coronado, and within 4 days we had it up and running. We combined our hospital with our city, who gave us this beautiful setting. We worked with Coronado Fire Department, who helped us give the immunizations. They also will go to people's homes to give immunizations if they have mobility issues. We had so many volunteers apply to help us at our clinic that we had to have a waiting list. Probably something that has made us all happy is that the community has rallied behind us. We've got the Seroptimists, we've got the Rotary Club, we've got the Optimists, we have many groups that support us, but they also came together not only to provide us with volunteers, but also to provide us with food. People in our city have donated to the Rotary and they get lunch for us every day. And when you're working long shifts giving our immunizations of up to about 1,200 shots a day, we truly appreciate the community being there for us and feeding us. I'm in charge of the clinical side of the fence. I do all the clinical volunteers, I manage all the sick people. I like to call my title All Things to All People. I can be prepping with the pharmacists, their syringes, I can be giving immunizations. I am with all the patients that have medical problems. Is this your second one? We give our immunizations here at the clinic in this beautiful facility, but we also do drive-bys. People can come up and we're happy to go out to the car to give immunizations. And there have been times where patients in hospital have had immunizations, perhaps their first shot of Pfizer or Moderna, and they go home and they live in a different city other than Coronado. And so I've had the opportunity to go to different cities to give some of our patients their second immunization. It's not only for the people that come here. The people that come here are so happy to receive their immunizations, but those of us that volunteer, and I am a volunteer as well, those of us that are volunteers, it feeds our soul to know that we're helping people. Remember when we started this in January, we were not allowed to be around people, and now we're asking these volunteers to come here and to be in with people who they don't know where they've been or if they've been around COVID positive people. And so we provided the safety aspect by giving all of our volunteers immunizations, but the volunteers say that they have gained so much more than they've given, and that's been a huge asset. The social interaction has been tremendous, and we all really love our jobs that we do here at this clinic. I'm not sure where you are in the world, but our biggest challenge at this clinic has truly been getting people registered for the shots. The online computer system has been exceptionally challenging, and so in our little town we've got people to help our seniors get their reservations, but also we started a concierge service where people can come into our clinic and sit with someone and they'll make the appointments for them. I think the challenge, other than the immunization reservations, has been a little bit, from my side as the lead vaccinator, ensuring that everybody's doing the same thing and following the same rules. The county is the one that sets the guidelines and how we run our clinics, and as a medical professional, we all know that we come with a lot of opinions. And so it's to ensure that everybody's doing the vaccine exactly how it should be given, and as a nursing faculty, you know I'm probably very good at that part. And so that has been one of the challenges working with these varied nurses and doctors. There's been a lot of challenges for our nursing students, whether they're from a baccalaureate program, they're from a community college, whatever educational facility they're at. There's not a lot of clinical placements for the students. The hospitals denied them placements in the acute care setting. They denied them in the long-term care setting, and so we had our students that are due to graduate and have not been able to because of lack of clinical hours. I commend both the California Board of Nursing and ACEN for their support of programs and being successful in achieving the goal. And one of our big successes at this clinic has been the use of our nursing students. I was able to contact several schools, and we have students here every day, 5 days a week, and it's been absolutely tremendous because we want these students to graduate. We're going to run out of nurses one of these days soon, and delaying their graduation has not been helpful. The role of the nursing students at this clinic has not been just giving immunizations. People think that it's about just giving the shots. It is so much more. They're doing communication from people from age 12 through 112. Well, that could be a little lie. I did have somebody 101 though. So they're doing immunizations, but they're communicating. They're learning to assess these patients. They're learning to check for anxiety, which has been a huge issue at a lot of the clinics. The students are using assessment skills, they're using communication skills, they're working with geriatrics, they're working with pediatrics. They have to look at time management. There's many skills that they do just sitting at the table giving the immunizations. Less than 30% of people. We've had people with chest pain, we've had people with mild pre-anaphylaxis issues, and so whenever we have these sick people, and it can be for our small clinic up to 10, 12 people a day, the students will come, they'll do an assessment with me, they'll do their vital signs. We have to determine, are these people having a sympathetic reaction with a letdown effect after vaccine, or are they truly having a heart attack, or what exactly is going on? So the students have really gained from this.
Hi, my name is Megan Tannehill. I'm a National University nursing student. Currently, we're at the Sharp Coronado Vaccine Clinic, and it's been incredibly beneficial to our education. Not only have we really mastered our skills more so, but our interdisciplinary skills as well, like getting to work with experienced nurses and experienced doctors, and really working on our person-to-person skills. Communication skills is extremely important as a nurse, remaining empathetic and really actively listening. And you know, it's as you're learning as a nurse, it's hard to juggle both the skill and making sure the patient's taken care of. And this clinic does a really good job of really helping us ground that and really lean on each other and really expertise in that realm. So I'm very fortunate to be here.
And I always try to put a health professional with a student. And some of these different doctors and nurses will identify to the students what they think makes a good nurse, what they don't like, what they do like. And it really helps these students to gain a different perspective. I would like to say one of the lessons learned from this whole session has not been just about immunization of a community, which in itself has been fabulous, but I think that a lesson that I would like to send to everyone is you must be out there networking. You must be out there being involved in your community. You can't be locked in your office as a director or as a nursing faculty. If you want your students to have opportunities, you need to be there. With this clinic, I knew to reach out to certain nursing directors. I was able to call the head of the County of San Diego chief nursing officer to say, what do I do in this situation with this patient? I belong to different organizations. I'm a Seroptimist who helps to promote education for young women. I was able to call them and say, hey, can you come and help us at our clinic? So networking, I think, is a huge asset. And so I hope you're all doing well in your communities. And I would like to say that we're going to move on to Nevada, and Dr. Sherry Lindsay will now take over and we'll hear about Nevada, and I look forward to seeing you in the chat room.
Hello, I'm Dr. Sherry Lindsay, the Nursing Department Chair for the College of Southern Nevada. COVID has been challenging for everyone, especially higher education and schools of nursing, with hospitals limiting the amount of students and with students losing valuable clinical time. Here are some students to tell you about their COVID experiences.
So my name is Jason McCorkle. I'm a nursing student here at UNLV,
And what semester are you in?
level 3 semester.
Okay, so you're about to graduate.
Mhm.
Okay, so how has COVID affected you?
In terms of clinical work, absolutely. Us not being in the hospital, currently I'm in OB and Gero. I have clinicals, which helps a lot. OB, I've been in the hospital on an OB unit one time, and that was honestly a life-changing clinical experience because what I saw was something that I couldn't learn from a book. So, and like I said, clinically, it's a super disadvantage, but I do understand the circumstances that we're in. But yeah, no doubt it has hindered my clinical hands-on experience.
Okay, and how has coming to the vaccine clinic helped you?
Yeah, I feel like that's helped me first and foremost in terms of communicating with patients. Here in the quick couple seconds or minutes that we have to interact with the patients here, I learned a lot about them. I learned about their life, a couple symptoms they experience, and I get to compare and contrast and see what type of interventions work that I can share with the next person. And yeah, that helps me communicate better with patients face to face, which is obviously going to happen a lot in the clinical field. And then obviously I'm giving IM injections all day. So that right there, giving it my first time was not my best time. I was a little bit nervous. I didn't hit the plunger right. The safety was messing up. And so obviously after doing probably hundreds of them, I would say I'm a pro now.
My name is Tiffany Richardson. I'm graduating from the ADN program at CSN. This is a year after COVID started. So last year I was in my second semester and third semester and transitioning from in-person patient care to hybrid learning and everything virtual. That was definitely a challenge, but I believe like the faculty and all the students, we all like pulled together and it helped us practice our clinical judgment and our reasoning and actually thinking more about patient care and what we should be doing rather than being in the environment, stressing because we were students. But it definitely did impact me. But I definitely think I've grown a lot since the beginning of this program, and I am stronger for it.
Start one more time.
Okay. My name is Krista Edwards. I'm a LPN student at CSN.
So how has COVID affected you and your schooling?
We really have to depend on each other as students. We really didn't have our clinical experience like we normally would. So we came to this vaccination center to cover our hours for the clinical experience.
And how has that experience been at the vaccine center?
Oh, it's very, very rewarding. Very rewarding. You come in, you have people that are so happy that you're actually here and you're given the vaccines too. They're very, very happy and they're very, how can I put it? Grateful. Mm-hmm.
My name is Gail. I go to Arizona College of Nursing.
So how has the COVID pandemic affected you?
School-wise, plenty, since we're learning a lot from home, so it kind of feels like we're more independent, if anything. But it also gives us a sense of just urgency to get better so we can get out of it.
Okay. And when you got the opportunity to participate in the vaccine clinic, how did that feel?
It was really cool, just because there's so many students out there who are just eager to get back into clinicals, and with COVID, we haven't really been put out there as much with everything going on, so it's been really nice being able to help and being such a big part of it, especially here at UNLV, so it's cool.
My name is Francisco Romero. I go to UNLV.
So how has the pandemic affected you?
The pandemic has been pretty hard, especially having to balance work and school. So it was difficult trying to convert to the online environment. But of course we had to adapt and change. So it kind of affected me that way, but I'm still here.
Okay. And the opportunity to be able to come to the vaccine clinic.
So the vaccine clinic is an amazing experience, especially since we don't really get to practice in clinicals. So this was just an amazing experience just to be able to help the community and just be out here.
Hello, my name is Medina. I am a student at UNLV.
Okay. How has the pandemic affected you?
The pandemic has affected me a lot, and I think my cohort can agree. We started our program in March of 2020, which is basically May 2020, where COVID was kind of at its peak. So like my other classmates, I'm sure they'll say, it really affected us because we had to do all of our school online, and we weren't able to get as much clinical practice as we'd like in our first level. But over time, we've gotten used to it, and we've adapted, and the school's helped us as well. So it's had a big effect, but it's going well.
And how about the vaccine clinic? How to get this opportunity?
The vaccine clinic is actually, I think it's a great opportunity because I think all of us are ready for us to just move on and get over this whole COVID situation. So it's really nice to kind of be part of the solution.
I got 2 minutes.
Contributing to helping eradicate it.
Okay, hi, my name is Michelle Jones.
And how has the pandemic affected you?
Well, I can't go out and do the stuff I used to do, and can't go to school, be with my friends, can't go do clinicals in the hospital, so it's affected me a whole bunch.
And what about this opportunity to be at the vaccine clinic?
It's a good cause, it's for a good cause, and gives us the hands-on experience, and we're making a difference, so that's the main thing. That's what I feel good about.
Hi, my name is Rita. I'm a student at UNLV.
And how has the pandemic affected you?
The pandemic has definitely been rough as a student because we did start our nursing program when the pandemic was at its peak. I think that it's been very difficult too with being at home. There's a lot of distractions while we're at home, so it's been pretty difficult to I guess get the focus and attention that most, I feel like, other nursing students have gotten, because you're also balancing, that Zoom, you're going to school with other siblings and working from home with everybody around the house. So it's been interesting, different.
And how about the opportunity to be a part of the vaccine clinic here?
Oh, it's been such a wonderful opportunity. I'm so glad that we got a chance to see see everything happen last year and then see how far we've come this year, helping out the community, giving out vaccinations, and seeing everybody being really excited getting their vaccinations too. So it's been great.
This time has been extremely stressful for faculty and students. To help mitigate some of the lost time, students were able to participate in a vaccine clinic hosted by UNLV Medicine. During these clinics, students were able to use the time as clinical, therefore gaining invaluable hands-on knowledge and experience while giving back to the Las Vegas community. Now here's Kathleen to tell you more.
Hello everyone, my name is Dr. Kathleen Zeich, and I am a nursing professor at the College of St. Mary in Omaha, Nebraska. As you all know, to describe this past year as difficult would be a huge understatement. But we did as we do best as nurses and nurse educators. We rose to the occasion, used our critical thinking skills and our ingenuity to create alternative learning experiences to best meet the needs of our students. If you are anything like me, when the pandemic hit, Standard 4 curriculum and Standard 6 outcome continually swirled around in my thoughts. How are we going to meet these two very important standards if our clinical affiliates were either shut down or were not allowing students into their facilities? Throughout this presentation, I am going to cover an initiative that our nursing program took on during the pandemic. It is my hope that you will see what great learning experiences we created for our students to do just that, meet Standard 4 and meet Standard 6. Because of my public health nursing background, I was fortunate to be selected as part of the COVID task force at the college at the start of the pandemic. Along with preparing for what our academics would look like once we returned for the fall semester, I was also involved with planning and implementing mitigation efforts for our college community. One initiative that presented itself was a partnership with the University of Nebraska Public Health Labs and the Douglas County Health Department, both of which are in Omaha, Nebraska. The partnership entailed opening a COVID-19 testing site on our campus. This clinic would be staffed by nursing faculty and students. This mitigation effort was to help identify any faculty, staff, or student who might be carriers of the virus without having any known signs and symptoms. This, in turn, would not only protect our own college community, but those in the larger community that may come in contact with one of our own. I knew this would be a perfect clinical experience for our public health nursing students. So after many discussions and figuring out all the logistics, our community partnership was formed. My fellow public health nursing faculty, Mary Lopez, who you will meet in a moment, agreed to coordinate the clinic, and we were all set to open. The clinic was at no cost to the college, as the community partners supplied all of the testing equipment, the PPE, and a courier to transport specimens to the lab at the end of each clinical day. The only requirement was that the room that housed the clinic had to have a separate entrance and exit, and we had the perfect classroom that met this need. The college was given the testing results within 24 hours, and any positive cases were followed up with our in-house contact tracer.
Hi, I'm Mary Lopez, Clinic Coordinator for the COVID Testing Clinic here at College of St. Mary's. This was an incredible time to be teaching public health with community health nursing students. It mirrored what was going on in the big world. On this small scale, our students learned about epidemiology, infection prevention, working with community partnerships, dealing with resistant community members, following CDC guidelines, and learning to collaborate with a team. The students really enjoyed this experience, and it was a fantastic learning experience. And now I'd like you to take time to see our clinic in action. Thank you.
Hi, welcome to our COVID testing clinic. You know, when people would first come in, they would check in here with where McKenna is sitting, and she would give them screening questions, take their temperature, and then move them on down. And here's our label pickup. So here they would tell us their identifying factors and verifying their date of birth, and we would print off the labels for the specimens that we were going to be sending out. And then over here, our testing centers. We have 4 of them. The girls kind of verify the date of birth of the patient and warn them about the nasal swab and how it's going to be administered, and then put the specimen over there in the cooler, which is going to be picked up at the end of our day or end of our shift by a courier from UNMC, Nebraska Public Health Lab. And we have one-way traffic here in our clinic because one of the criteria is that they had to have an entrance and an exit. And so this room really facilitated our needs, and we were able to conduct our clinic.
You can take a seat if you'd like, or you could stand. I just need you to verify your name and date of birth for me today.
Kelly Murphy, June 12th, 1976.
Perfect, and how are you doing today?
I'm doing well, how are you?
Good. Alright, well this is just a COVID swab, and it's only going to go into your nostril, and I'm just going to swirl around 4 times.
Okay.
Okay. And that is all that you have to do. If there's a clinic there for you, if you'd like.
In all of the hundreds of
Alright,
tests
thank you.
given, only 2 positive tests were identified. I believe this is a true testament of the mitigation and educational efforts implemented by our entire community. This would not have been possible without the support of countless individuals. The clinic was an invaluable learning experience for our students and to our college community as a whole. But don't take my word for it. Listen to what some of the students have to say about their experiences.
We did at College of St. Mary because I was able to relate the concepts that we've learned in theory for screening and prevention and use them actually in a clinical setting. So I thought that was very important.
I thought this was very important for the students for public health to actually get the chance to be a part and witness a once-in-a-lifetime pandemic and see how surveillance, control, prevention can go in the community.
I thought this clinic was very enjoyable and beneficial to our CSM community because we got to experience partnerships with outside resources in order to prevent the spread.
I also feel this clinic was important because we got to see firsthand how much work and collaboration goes into doing a clinic to do screening and prevention. And we ran a smaller clinic, but it's the public, they have all the huge clinics, businesses, and hospitals had to put together, and how much work and teamwork is involved in those.
Do you think that you were able to meet your course outcomes by doing this clinic?
Yes.
Okay.
Absolutely.
How so?
I feel like we got hands-on. I mean, we learned about primary prevention, secondary prevention, and to see firsthand how important screening is to stop and slow down the pandemic.
Okay. Would you recommend doing something like this in future years if we had the opportunity?
Absolutely.
Absolutely.
Do you think you're better prepared as nurses by doing this experience?
Yes.
We were able to interact with they were patients, but even though they were from our own community, we were able to interact with them and play a professional role in the participation of slowing the spread of COVID.
And understanding why people are getting screened and be able to provide that. Some people were traveling, some people were needing to go back to work, some were just wanting to know if they had it. So it was interesting to hear like the opposite side of why they wanted to be screened.
Thank you so much for this opportunity to showcase our COVID testing clinic at the College of St. Mary. We are now going to go to New Mexico, where Diane is going to discuss initiatives implemented at her university.
Welcome to Central New Mexico Community College, located in beautiful Albuquerque, New Mexico. We are the largest community college in the state, and we pride ourselves on providing premier, inclusive, and affordable education to the community we serve. With 9 campuses in the greater metro area, even during COVID, we teach over 20,000 students each term. Our nursing program is also robust. We offer the program at 2 campuses located about 25 miles apart, admitting a minimum of 96 students 3 times a year. Enrollment on any given day is typically around 400 nursing students. We're also a partnering school in the New Mexico Nursing Education Consortium, or NEMNEC, so we share a common curriculum down to course descriptions, course numbering, and evaluation tools. We also offer a concurrent BSN option through partnerships with our state universities. My name is Diane Evans-Pryor, and I'm the nurse administrator for this program. March 2020 hit us all like a freight train. One day we were at work, the next everything changed. I remember hearing people saying, oh, okay, so we'll work from home for a couple of weeks, it'll be fine. But for those of us in healthcare education, we suspected that we were going to be in this a lot longer. The next weeks and months were an absolute whirlwind. Our hospitals and communities said that they needed our help, and we were ready to answer the call. But then suddenly there's no PPE, there's no clear lines of supervision, and no clear answers because our world shifted hour by hour. We found ourselves having real ethical debates, not just the philosophical ones we use as exemplars for our students. Is it malfeasance to put students into harm's way in the name of experiential learning? Is it just to keep students and faculty at home when we have the manpower and expertise to provide meaningful and desperately needed help to our community? Who shoulders the liability when a student gets sick, when that student dies? My faculty. I know they're in this with me as far as we need to go, but how much risk can I reasonably ask them to assume? So I'm sitting in my new home office, AKA my craft room, the first Monday of quarantine. My phone is blowing up with texts and phone calls, and I'm getting literally 8 to 10 emails a minute. I remember feeling completely impotent and overwhelmed. I was thinking, there's no playbook for this. What I really wished I'd realized that day, and luckily we figured out pretty quickly thereafter, was that there actually is a playbook for this. It's our ACE and accreditation standards and criteria, easily the most powerful tool in our tool belt to help guide these sudden and extreme curricular changes. Moving to online learning for the didactic courses was fairly straightforward. All of my full-time faculty and many of my part-timers are distance learning certified already, so beyond the time needed to make the conversion, we were in pretty good shape. Having ACEN convey the US DOE's temporary reprieve for the need to submit substantive change reports due to the shift to DL was a true blessing. But what to do about labs and clinicals? How do we pivot to online experiential learning? What an ugly or oxymoron. Online experiential learning. Well, we have the summer to figure this out. While the ACEN standards and criteria deliberately are non-prescriptive about simulation, our Board of Nursing rules here in New Mexico were pretty clear.
we could not exceed 50% clinical substitution with simulation. And before the pandemic, none of our NMNEC programs were even close to that cap. NMNEC let this up to the individual programs to implement as their resources allowed. So during COVID, however, we found that moving online would smash through that 50% threshold pretty quickly, leaving us with little recourse. Faculty and program directors from our NMNEC schools met by Zoom weekly. And I am not gonna lie, for me, these meetings were the single most effective and supportive factor in navigating the impact of the pandemic on instruction. It became apparent quickly that because of operational differences, we had varied interpretations about how simulation hours were counted. Some programs would calculate the percentage based on the total number of lab and clinical contact hours by the college definition of what a lab is for the whole course as a whole. Some programs calculate the percentage based on a subset of those clinical hours, which were identified by the program to be associated with direct patient care. From there, we looked at simulation in two distinct categories. So first is skills acquisition. This is formal and informal scenarios used to demonstrate skills and to provide the context to the learner so that they view the skill through the nursing scope of practice and responsibility beyond just the task. This can also be used to reinforce skills learned in previous semesters. These provide psychomotor practice, incorporating nursing-based decision-making associated with those specific skills, so planning, teaching, implementation, etc. The second is nursing clinical competency development, and we also call this synthesis simulation. Formal scenarios where students demonstrate clinical reasoning and develop clinical judgment while incorporating their nursing knowledge and all of those kinesthetic skills into care for a simulated patient. It would be this type of simulation that we would count in our formulas. We provided guidance, sharing a spreadsheet that made the calculations for the programs with minimal data input. This ensured that all of our partnering schools were reporting to the Board of Nursing and ultimately the ACEN when the time came in a consistent and data-supported manner. This strategy also provided us with the hard data to extrapolate what-if scenarios on when exactly we would be likely to exceed that 50% threshold, which was confusing because it would still vary by cohort. The forecasting information was presented to the Nursing Education Advisory Council and the Board of Nursing, and we secured a rule change to allow an increase in simulation caps during a healthcare emergency. NMNEC also defined, and outlined the use of computer-based clinical simulation, including requirements for student technology orientation, pre-briefing, debriefing, which the majority of us chose to do synchronously, and evaluation. With these in place, we knew what we implemented would meet Board of Nursing and subsequently ACEN requirements. It was an early victory, and at least for me, I felt like I finally had some traction. We found out early that our clinical partners and the Department of Health were more than happy to take students to support the vaccination cause, so long as an instructor is present. By the time the vaccine was available, we had very limited access to hospital sites, but the key is that we did have access. I didn't want to pull a faculty from a hospital to cover a vaccination clinic, and most of my faculty who were assigned to virtual clinicals had valid medical reasons not to expose themselves to crowds and unvaccinated populations. I didn't feel comfortable mandating faculty participation. So the solution was that the Department of Health suggested that we mobilize and manage students through the Medical Reserve Corps, and we suggested adding a preceptorship model. Let me share how ACEN helped. Criterion 4.10. The ACEN is very clear that we must have current contracts with protections for students and the clinical partners. So we secured a clinical affiliation agreement between CNM and the Department of Health. I was pretty amazed at how quickly those contracts were signed. It only took a couple of days. 2.4. The Department of Health and our program agreed on identifying one registered nurse from the Department of Health at each site to manage our students on site. They worked with us to ensure that these nurses were academically and experientially qualified. Also for 2.4, we modified our capstone preceptor handbook and provided these DOH nurses with the handbook, with orientation, and with ongoing support. Criterion 4.7. We also provided our new preceptors with an online form that provided a way to perform a quick but meaningful assessment of the student's participation so faculty could better evaluate the student's achievement of the clinical objectives.
Criterion 4.9. We tailored student homework and reflection assignments to support our concepts and exemplars, making it so that a student could conceivably repeat an activity, but look at that experience from a different lens each time, such as disaster response, social determinants of health, healthcare disparities, and health promotion. These were matched to course, level, and program learning objectives. All of these initiatives together made it so that faculty were free to continue in clinical, and our Level 1 students, for whom long-term care was completely closed, had the opportunity for actual patient interaction while supporting critical public health initiatives.
Putting this presentation together has reminded me of just how crazy 2020 was. I'm so grateful that we are where we are now, seeing some light. I'm grateful for my faculty, my amazing and resilient students. My NEMNIC partners, I could not have done any of this without you. My institution, the Board of Nursing, and the ACEM. It took every single one of you to get our program and our students through this, so thank you. You've heard from our 4 different program types. We'll now shift back to the live meeting for questions, comments, and deeper discussion.